everyone, this is Dr. Vijay, Consultant Pediatrician and Neonatologist, Medicover Hospital, Vizag. So in this short video, we'll talk about complementary feeds. So that is, in simple words, that is introduction of semi-solids to the infants. So when it comes to complementary feedings, we have to see the timing. So when you have to introduce the feedings for the baby. So usually, as per the recommended guidelines, 4 to 6 months of age is the appropriate time for introduction of semi-solids. Okay, then what we have to do is we have to assess whether the baby is ready for the intake of semi-solids or not. So the readiness is known by few things. That is, the baby will be able to sit and there will be proper head control, and the baby becomes fussy even after adequate breastfeeds. So these are the signs of readiness. Okay, so when we introduce feeds, we have to introduce one food each time. So thereby we can assess the digestibility, so the digestion capacity of the child. So we usually prefer soft and easily digestible foods for the child. What we have to do is we have to continue the breastfeeds and we have to give the semi-solids in between the breastfeeds. And to start with, we have to give initially the food with thin consistency, and gradually as the child accepts and as the child is able to propel the food, we have to increase the consistency to semi-solids. And one more thing is that we can also add water, that is to few substances like fruit juices. So where we can add equal ratios of water, boiled and cooled water to fruit juices, so as to dilute it. And when it comes to fruits, we have to clean them and we have to wash them, peel them off, and we have to de-seed them, that is removing the seeds. And after de-seeding, we have to mash the fruits. So we have it will be difficult to give the fruits as a whole. So we do all this process and mash it and then give it. Whenever we introduce new foods to the baby, we have to make several trials. That is, the child can reject the food. So we have to give a pause or a free period. So like 1 week we'll wait and then we'll have to reintroduce the feed. So, and one more thing is that for making it more calorie dense, we can add oil, butter or ghee. And addition of salt or sugar should be as much as possible we'll have to try to avoid. And because addition of sugar particularly, it can affect the eruption of the teeth. So water can also be given apart from the semi-solids in between the feeds. So we usually give the breast feeds, and in between the breast feeds we'll be giving semi-solids, and at times we also give water. So whenever the child objects a single food, if the child objects a particular food, we can add cereals or vegetables so that the child can accept it. So usually a straight food can be rejected by the child, whereas the same food, when you introduce with a cereal or a vegetable, the child will show willingness to accept for the baby. And few foods, for cooking of few foods like kheera, we can add milk. And usually we'll have to give many varieties of foods, all varieties of foods like cereals, pulses, and many vegetables, fruits. We have to give all varieties of foods to the child, not like a monotonously like a single variety of food frequently. So giving variety of foods can help avoiding micronutrient deficiencies also. So always we have to prefer to give freshly prepared foods to the child. And one important thing is that it is not mandatory to give branded commercial formula to the children. So we can give both homemade foods and also the branded formulas. We can give a mix of both. And to conclude this video regarding the complementary feeds, we have to know when to start the complementary feeds and what to give, what type of food to give, and how to assess whether the child is accepting or not. So these are few important principles of complementary feeding which will help in the nourishment of the child. Thank you.